Oh, I clicked the wrong button, so we're just gonna go with it. I started the outro as opposed to the intro. Um, this was an interesting article. I'm gonna bring it to you from the Control Center. It's the transitional epigenetics of caregiver anxiety to pediatric anxiety. The introduction, it says pediatric individuals with anxiety represent a rising population of patient care, as Archives of Pediatric and Adolescent Medicine identifies 25% of Americans will meet the criteria for an anxiety disorder, with the earliest manifestation being 11 years old. And this was further supported by the CDC, which found 7.1% of children aged 3 to 17 have been diagnosed with an anxiety disorder. Anxiety among pediatric. I'll just see. Let me just come in here. You can go look up this paper. I gave you the title if you want to really pick it apart. Anxiety among pediatrics can be shown at school, absenteeism, and poor academic performance, which can transition to functional impairment, economic burden, oh, heaven forbid, and psychiatric conditions. Now you kind of see why they say that eventually will be full of what is the term that the elites like to use? Useless eaters. This is why. This is what's going to happen to everyone. Generalized anxiety disorders in children are determined by the DSM criteria, which we already know is full of crap, with a general focus of excessive anxiety and worry most days of the week for different environments of life. Due to the implications of untreated mental health disorders in children, there is recognition to address the why, which has led to focus of environmental behavior and or biological aspects transmitted from a primary caregiver that leads to the development of early anxious traits. What's a primary caregiver? Not the mother. Evidence from literature reviews are to both explore a causative relationship and increase medical provider awareness of common childhood anxiety disorders for improved clinical care for the pediatric population to reduce the future retrogression of mental health for both individuals and society. And here it's got a little picture. So here are the results. Just the terms they use here tickle me. Are pediatrics age 17 and under, the P, who have at least one primary caregiver with a diagnosed anxiety disorder compared to those without anxiety, at the increased risk of developing anxiety disorders during their early lifetime? Parental anxiety disorders, AD. So after what is it, whatever the D stands for, BC or AD. The results: offspring of parents with an anxiety disorder were significantly more likely to have anxiety and depressive disorders. If those offspring, risk for anxiety were higher than for depressive disorders. In addition, those offsprings were increased risk for separation anxiety, specific phobia, and GAD, but not social anxiety disorder or panic disorder. While prenatal anxiety exposure does not cause offspring to internalizing problems, postnatal anxiety exposure may be related to concurrent offspring emotional problems associated with anxiety and depression through non-genetic and environmental pathways, such as modeling processes and social learning. Now, I ask you, and now that you're saying, do you really believe that some of these teachers are somehow immune to psychological problems while they're teaching our children, and we have a different teacher every year, sometimes several, especially preschools and daycare centers are notorious for overturning teachers. So there's no consistency there, and they're also struggling, and they're teaching your children. That's what this sounds like it's saying to me. While prenatal anxiety, I said that right. Or did I? Yeah. Harsh, punitive parenting may contribute to social anxiety in adolescents. Don't be too hard on your kids. Offspring of depressed and anxious patients are very high risk of a mood or anxiety disorder themselves. Parental early onset, having two effective parents, female gender and family functioning are important additional markers that can be used in clinical practice to identify those offspring at a greater risk. I know one next door, a family next door to me. Is what I don't talk to them anymore. But when I had been talking to them and getting to know them to see if, they're potentially, their child could be a fun friend for my daughter, I found that this whole family is full of people who not only claim to have anxiety disorders, but boast about them and use them as an excuse to act weird. And I act weird, but I very rarely just walk up to strangers and say, although sometimes I want to. And so so the child is walking around thinking something is wrong with them, and of course is already on medication at the time, which has been a few years, 6 and 7 years old with a younger sibling and a potential baby on the way. And these types of human beings are just at a loss for how to deal with their lives. And so, I'm hearing my neighbor as I'm reading this. Who are the people in your neighborhood? Who are the people you are letting your kids? Who are these people? They work at schools. They work as police officers. They work as social service workers. They work as doctors. They're in very high stress environments. They're in the military. They're normal people. There is not one person on the planet that is immune to any of these issues. We have mentally ill people in the care of other mentally ill people. That's what it sounds to me. Here's their methods, their conclusions. We should identify pediatric anxiety disorders early and implement intervention strategies to help mitigate mental health disease from progressing. And it's got something about the university in Sydney in Australia. Parents who participated in a 6-session patient education program had children who showed significantly decreased risk of anxiety and anxiety-related disorders at 12 months as opposed to a control group. Early therapy works. Clinical trials tested clinician-facilitated discussions separately with children, parents, and family unit. And studies showed that therapy resulted in a significant improvement in the mental well-being of both the children and the parents at 1 year and 2.5 years post-intervention. They've got a whole page. The second page is nothing but the references. Well, there you have it. They're on it. Don't worry. We're working on it, everybody. Hang in there.